The cleaning process for a lung volume recruitment kit, or LVR kit, may vary depending on the brand. Some LVR kits have a two-piece stacking valve, so the two parts can be pulled apart and cleaned separately. The kit we're using uses a one-piece stacking valve and flex tube, so you simply disconnect the flex tube from the bag and wash and disinfect the stacking valve and flex tube without separating them. First, fill a sink or large bowl with a mild soap and water mixture. Disconnect the mouthpiece and tubing from the resuscitation bag. You don't need to take apart the resuscitation bag. Wash the mouthpiece and the combined flex tube and stacking valve. Then rinse in warm water. The LVR mouthpiece, stacking valve, and flex tube should be cleaned once a week. If you have a cold or a chest infection, you may want to clean the equipment more often. If you're not going to disinfect the parts, let them air dry before reassembling the kit. And note, do not use a blow dryer or towel to dry the parts. It's worth noting, since the LVR kit uses a one-way valve, the inside of the LVR bag won't be exposed to germs and bacteria, so it won't need regular cleaning, except to remove any excess dirt or oils from the outside of the bag. To disinfect the flex tube, stacking valve, and mouthpiece, mix a solution of 1 part vinegar and 3 parts water in a bowl. Disinfecting the parts is especially important if you've got a cold or chest infection. Soak the parts in the disinfecting solution for 30 minutes. Then rinse all the pieces in clean water and let them air dry on a towel. Again, do not use a hairdryer or towel to dry the pieces. Once all the pieces are dry, put the kit back together, making sure the small capped valve on the top of the stacked valve is closed. If it feels like the resuscitation bag is not delivering the full volume of air, it may have a leak. To test it, first, if your LVR bag has a vent on the head, be sure the cap is screwed on. Then, with one hand, cover the top outlet, and with the other hand, squeeze the bag. No air should leak from the bag, and the bag should not deflate. If the bag deflates, or if a leak is heard, the bag needs to be replaced. Contact your registered respiratory therapist or home respiratory company to order a replacement, or see the link in the video description for vendor info. Be sure to watch all the other breath stacking and assisted cough videos in this series, listed in the description below this video, and speak to your healthcare team if you think breath stacking and assisted cough is something you should make a routine.